hypertension is. There is no symptoms many, many times, okay? So I would encourage you. I have patients all the time, new and old, who come to the office and they say, this could be a new patient. They say, you know, I ask them, do they have any history of any major illnesses? Their first answer to me is not a single disease. I feel great, doc. I've got no diseases whatsoever. I'm staring at the chart. I see that my nurse has seen, he has a blood pressure, or she has a blood pressure of 150 over 90. And I know that their blood pressure's up, and I'm asking them, and they say, no disease. I have no chronic illnesses. And no symptoms. That's just the norm, okay? Which is why it is so difficult sometimes to get people to come in to treat their hypertension or take their blood pressure pills because they have no symptoms. But make no mistake, it is damaging you, even when you have no symptoms. Chest pain. But that's something that has taken time to occur. So which is why I'm saying if you start getting chest pain as a result of high blood pressure, you needed attention like a long time ago, right? Lightheadedness, confusion, same thing. I mean, if you're having that kind of thing, it's way past time. Seizures. Wow. Same sort of thing. The vessels that are leading to brain tissue become compromised. You get stroke, you get seizures, you get all these sorts of things. I would encourage you, once again, though, that the most common thing is no symptoms at all. And the best and optimal way to discover high blood pressure is on routine evaluation, routine physical exams. In fact, that's probably the majority of the way that I discover hypertension in the masses, is just through routine evaluation. Normal blood pressure is 120 over 80 and below, okay? 120 over 80 and below. So I have people come to the office and they say, their blood pressure's 110 over 75. That's too low, doctor? That's too low, isn't it? I don't want to stroke out. That's too low. No, that is not too low. That is the healthiest place you could be. I mean, we want to bring your blood pressure down as low as we can possibly get it. If you come in and you're feeling good now, and your blood pressure is 100, 99, okay, over 65, happy as a lark, no symptoms, I'm loving it. It's associated with a long life. Don't be scared of that. That's good, solid blood pressure. Define what's causing their blood pressure. 5% of those individuals have some sort of kidney or urinary tract issue. Understand that the kidney is intimately responsible for controlling blood pressure. So if you have a kidney stone blocking your ureter, it can cause your blood pressure to immediately go up, and if we were to fix that thing, boom, your blood pressure's gone. Your blood pressure problem's gone. There's some people who have blockages in the arteries leading to their kidneys. If we fix that problem, boom, their blood pressure problem's gone. So I'm saying this, obese people we're talking about, yes, and I cannot tell you the number of times that I see, in my office we have electronic medical records, so we're able to track their blood pressure and track their weight simultaneously on a graph. And every single, it's almost 99% of the time. When we see a rise in blood pressure, a rise in weight, we see a corresponding rise in blood pressure. When we see a dip in their weight, we see a dip in their blood pressure. And every time, the blood pressure graph follows the weight graph. And I'm not talking about 30-pound weight losses. I'm talking about 5-pound weight losses. I'm talking about 2-pound weight losses. Weight loss is a really magnificent blood pressure lowering, benefit. makes a big, big difference. These potatoes are weird. So,
Or a peanut.
yeah, it's like eating one peanut or one grape. I mean, who does that? Nobody does that, right? So, yeah, it's just unsatisfying. So, the better thing to do is just to really remove it from the lifestyle altogether, and you're not even dealing with trying to control that.